Today I'm going to talk a little bit about stroke because it is Stroke Awareness Month, and it's important for us to have some basic idea of what we're talking about, what we can do about it, and how hopefully we can prevent it, and in some cases, sometimes we treat it actually. So I'll start with really a definition, and it's really kind of it's a very simple one. It's something that we can identify with when we talk about a heart attack, for example, when the blood flow is interrupted and stopped and does not go to a certain territory of the heart. It causes the death of certain heart tissue, and that's a heart attack. And the brain is also an organ that is irrigated with blood flow, and very, very important that the blood flow is maintained and oxygen is delivered in that blood flow. And when there's an interruption or an obstruction of blood flow to the part of the brain, that part of the brain, that brain tissue dies. And some people call it a brain attack. It's actually a stroke where that particular part of the brain is going to lose its function. And there are different parts of the brain, and there are different parts of the brain that are responsible for function. Some of them are movement, and some of them are feeling, some of them are speech, some of them are sight, some of them are balance. And all these symptoms can be identified and translate into certain areas of the brain that are affected by this interruption of the blood flow. So the mechanism of the stroke is just like a mechanism of the heart attack, is where the blood flow is interrupted in the arteries, and there's no more blood flow that goes to that territory, so no oxygen gets to that territory, and those brain cells will die. And in general, an interruption of blood flow and deprivation of oxygen for more than 4 minutes will have a lasting effect. Not all the time, because there are some times that blood can actually go through collateral blood vessels, which are smaller blood vessels around, and irrigate the tissue, and then it's not as dramatic and permanent a symptom. There's also something called a transient ischemic attack, or a TIA. And again, when we look at it in terms of comparing it to the heart, it would be like having chest pain before a heart attack that can come and go before the heart attack actually occurs. This TIA, or transient ischemic attack, is a symptom of a stroke that is reversible. And there is an acronym for that. It's they like us to remember the word FAST, which is the F is corresponds to what we see as facial drooping. The A is reflects arm and leg weakness, and S is slurred speech, and T is meant for us to remember to call 911. Because if we do that, we have an opportunity to intervene in a certain window with treating this symptom, which hopefully will turn out to be a transient ischemic attack and not a stroke. The symptoms of a stroke will vary depending upon the area of the brain that's affected. As I mentioned, there are areas that are responsible for strength and movement and standing. There are symptoms that are related to speech. There are symptoms that are related to balance and swallowing. All of these will be reflected in the testing that we do, which most often this time would be a CAT scan and an MRI of the brain. Importantly to know that there are certain risk factors involved in the development of these vascular diseases, and we kind of put them all together if there are vascular diseases, whether it's the heart or the brain or the kidney or the peripheral vascular disease where we don't get enough blood to our feet and to our hands. The risk factors really that involve all of us are things like hypertension, high blood pressure, hyperlipidemia or high cholesterol, diabetes, atrial fibrillation, which is an irregular heartbeat that is related with an increased risk of having a stroke. There are some specific risk factors that affect women in particular. Advanced age is one, of course, but pregnancy is sometimes related to a hypercoagulable state or increase in developing blood clots. Smoking is another risk factor, and particularly important in females. Contraceptive use or hormonal replacement sometimes increases the risk of stroke. African Americans and Hispanic Americans are at increased risk of having strokes. There is a treatment for this, and there's a window of opportunity between the onset of the symptom and the time at which we can treat. with medication, an intravenous medication that's given at the hospital called TPA, or tissue plasminogen activator, called commonly Alteplase, which is the brand name. And if we get to the hospital within a 3 to 4 hour period of time, actually a 3 to 4.5 hour period of time, we can use this medicine intravenously, and it'll act as a clot buster, so that it hopefully will open up the artery and allow more blood flow into that particular area that's been affected. The prognosis of a cerebral vascular accident or a stroke varies on the territory that's involved. It varies on the period of time that the symptoms are there. Depends on the size of the blood vessel that's affected. But in general, we like to see resolution of symptoms, or the improvement of symptoms, within 72 hours after the onset of the stroke. We definitely do take care of things from point of view of risk factors by hospitalizing people and making sure that we control the blood pressure, control the blood sugar, control the cholesterol, and use the proper medications. And the prognosis and the treatment has really changed a lot over time, and we've been really able to make a big difference in how stroke affects us in the long term. So I hope that's been helpful. It's a very, very important issue and topic to remember. And remember that window of opportunity is 3 to 4.5 hours, and if we interact and act within that window, we can make a big, big difference. Thank you.